racing, boys!
Goals for Phase 3 include satisfactory non-painful range of motion. If the patient still has limited range of motion, an increased push for further motion should be established. If the patient has full range of motion, increased strengthening activities can progress. Dynamic control of the humeral head is another goal for this phase, as well as increased strength and endurance of the external rotators. Also, if any deficits of the upper extremity are noted, they should be addressed and fixed immediately. Finally, the athlete is able to increase functional activities along with weight used in rehabilitation.
So we're now in phase 3 of the NASCAR Jackman's return to play protocol. So when we start the warm-up for today's rehab, we're going to start on the bike for 10 minutes at a nice easy pace. You can grab onto the handles as well to help warm the shoulders up. Then after 5 minutes, we're going to move on to another exercise. For the next component in our warm-up, we're going to be doing side-lying thoracic rotations as well as hollow rocks. So we're going to start with the thoracic rotations. So the athlete's going to lay on her side, hips and knees at 90 degrees, hands out in front. You're going to rotate that top hand all the way back and touch the ground. And we do this to work on thoracic mobility and posture. And once she does 10 reps on this side, I'll have her roll over and do 10 on the other. For the next exercise we're going to do are hollow rocks. So they're going to be laying on their back, slight leg lift, and now they're going to keep that body position as they roll back and forth. The prescription for this will be 15 repetitions back and forth. Okay, so for the next group of exercises in the warm-up, we're going to be doing angels and PNF claps. So for PNF claps, the athlete's going to have their hands in front of them, and then they're going to open up in a diagonal pattern, and then come back together, and then go in the opposite direction. And you're going to repeat this 10 times in each direction. After they're done with that, we're going to be doing angels. So the athlete will get into a split stance, hands overhead, and then you're going to do small oscillations of about 2 to 3 inches all the way through the range of motion up and down. For the last exercise in our warm-up, we're going to be doing scap sets. So here, the athlete's going to have a band with one loop in each hand, and they're going to bring their hands down to their side, and they're going to squeeze their shoulder blades back and down. Once they squeeze their shoulder blades together, they will hold it for 3 seconds, and then relax and repeat again for 10 repetitions. For this exercise in the rehab session today, we're going to be doing wall slides to work on the serratus anterior. So the athlete's going to place their forearms up against the wall, and then they're going to slide up and then back down, while trying to keep the scapula nice and pressed against the rib cage. We are going to repeat this for 3 sets of 10. For the next exercise, we're going to be doing step-ups, and we're going to add a step-off component as well. So the athlete is now going to hold the kettlebell at shoulder height, and then step onto the box, and then step down. We're going to repeat this for 3 sets of 10 reps. For the next exercise we're going to be doing, it's going to be for the pull-up progression using the pulley system. So for this, the athlete's going to be standing about arm length away from the pulley, and then we're just going to start pulling. We're going to do this for time. We're going to go 3 sets of 1 minute. For the next exercise, we're going to be doing side lying external rotation. So here, Athlete will be laying on their left side and holding the weight in their hand with a towel in between their arm and their side. They're going to externally rotate and then come back down. We're going to repeat this for 3 sets of 15 reps. For the next exercises, we're going to be doing internal and external rotation with the band. For this, their elbow is going to be tucked to their side. They're going to step out, get tension on the band, and internally rotate. And then they're going to rotate and perform external rotation. And then after they're done with internal and external rotation, they're going to grab the other band, and we're going to be performing punches. The punches are going to be performed for time, 3 sets of 30 seconds, and the internal and external rotation are going to be performed for 3 sets of 10 reps. For the next exercise, we're going to be performing TRX flutters. So for this, the athlete will have their arms straight out in front of them in a slightly lean forward position, and then they will move their hands up and down in an oscillating pattern. They're going to be performing this for 3 sets of 30 seconds. Okay, so for the next exercise, we're going to be doing seated or kneeling cable row. So the athlete will be in a split stance position with their arms straight out in front of them, and then they're going to pull their elbow back while squeezing their shoulder blade back and down, holding it for 1 second at the back, and then coming forward again. They're going to perform this for 3 sets of 10 repetitions, and you can vary the weight accordingly. So for the next exercise, we're going to be doing shoulder flexion and shoulder abduction with weight. So for shoulder flexion, we're going to have the patient raise their arms straight up in front of them, the thumb pointed up towards the sky. This will be performed for 3 sets of 10 reps. And then for abduction, they'll be raising it up to the side with their thumb up. And this will also be for 3 sets of 10 repetitions. Okay, for the next exercise, we're going to be doing scat push-ups on the wall. So, athlete's going to have their arms straight out in front of them, with their arms locked, with their elbows locked. They're going to be protracting and retracting the scapula, holding for a second in each position. This is going to be performed for 3 sets of 20 reps. So what we're going to be doing next is joint mobilizations, specifically for external rotation and flexion. So I'm going to apply a slight distraction force, and then I'm going to apply an inferior oscillation. Then I'll repeat this for 3 sets of 30 seconds. So next we're going to be doing some gentle passive range of motion. So I'm going to start with flexion. I'm going to go through full range. And then abduction. Cross-body adduction, and horizontal abduction, and then work on internal external rotation as well. This is to work on thoracic mobility, which will help with